Hello everyone, my name is Heath McMichael and I'm President of the ACT branch of the Australian Institute of International Affairs. Welcome to our first online event. The coronavirus pandemic has meant that we are unable to deliver our program in the normal format here at the AIIA National Conference Centre at Stephen House in Deakin. Beginning this evening and for the next little while, we will be delivering our events via Zoom to those of you who have registered on our website. So please bear with us as we get a mastery of all the technology. Tonight, we welcome back our long-standing and some newer members who come along to our regular face-to-face meetings. We also welcome a number of participants who may be new to AIIA and the ACT branch, and I hope you will like what you see and hear and be motivated to join us as members. Now, let me introduce our speaker, Mr. Leonard Blazeby, the Head of Mission for the International Committee of the Red Cross in Australia, resident here in Canberra. We're very grateful Leonard was willing to be the test pilot for our inaugural virtual speakers event tonight. Leonard leads a team who works closely with government, military, diplomatic, and academic circles to promote the Icrc and its activities. His work fosters a broad understanding of the Icrc's global operations and encourages dialogue on international humanitarian issues and law. Since joining the Icrc in 2000, Leonard has held a variety of positions across Africa, Europe, and the Pacific. He worked for 8 years in Africa, serving as legal advisor and deputy head of delegation in Southern Africa and communications coordinator in the Horn of Africa. He then served in the Icrc's Geneva headquarters for more than 4 years before taking up the post as head of mission here in Australia. And before joining the Icrc, Leonard worked as a barrister and solicitor in South Australia and Victoria and volunteered for the Australian Red Cross for more than a decade. Tonight, Leonard will focus on the impact COVID-19 has had on highly vulnerable detention and displaced person refugee camps and on weak health systems in different parts of the world. He will provide us with examples of Icrc's responses to those daunting challenges. Now, just before we commence, a couple of housekeeping messages, if I may. I'm sure most of you by now are familiar with the Zoom application we're using, and I find it's pretty intuitive. As per our normal meetings, our speaker will talk for around 20 minutes or so before taking questions. For the Q&A session, please type in your question at the Q&A icon at the bottom of your screen there. Your questions will flash up on the screen in front of us, and I will aim to ask Leonard as many of them as time permits before we finish at 7 p.m. So let me ask Leonard to commence his presentation. Over to you, Leonard.
Thank you very much, Heath, and thanks for AIIA for having the Icrc here this evening. It's a great opportunity, and I think I understand that we've got a large number of registrations this evening, so I hope that we're able to satisfy the interest of a lot of people. Thank you. So just a little bit first, I think, about who the Icrc actually is and what we do. The Icrc is a neutral, impartial and independent humanitarian organisation. It's quite unique in that it's got a headquarters in Geneva, that it has a staff of nearly 20,000 around the world from now 120 nationalities. And our focus is mainly in armed conflict and conflict-like environments around the world. So our work is really to protect and assist those people who are affected by conflict, whether it be civilians, whether it be people who are detained, or whether it be wounded and sick people who are members of the armed forces or armed groups. So that's the general work of the Icrc. So you can see, I think, from that, how something like COVID really affects the work of a humanitarian organisation like the Icrc. So COVID has really hit the world hard. It is seen as an unprecedented crisis, and it's thrown the world into a spin. Here in Australia, we've seen the dramatic effects of this disease. We are subject to restrictions on travel and on physical engagement. We all know people who've fallen ill, perhaps people who have died, people who have lost their livelihoods as a result of this crisis. The tragedy in Australia is deep and it's real. But this is also a global crisis. It's a crisis that also requires a global response and solidarity across borders. The ICRC has already called on states, on the public, on private organisations to stand together. We must help countries that are already struggling as a result of conflict, and to whom this is another layer of complexity. We would say that none of us are safe until all of us are safe. For countries facing armed conflict, the stakes really couldn't be higher. The world's biggest health challenges are generally found in health systems and in infrastructures that have been ravaged by war. For people living in war zones, COVID-19 is just one more threat. When you're already dealing with suffering, when you're already faced with threats to life and limb, to gunfire, to shelling, to bombings and or lack of life-saving healthcare, this is a real challenge. It's a challenge to prioritise actions that could prevent the spread of COVID-19. With limited capacity to detect and manage and follow up cases of sickness, the risk of transmission in these war-torn countries is high. The idea of further strain on an already frail health system is, for us, extremely worrying. The ICRC is responding to this crisis by reorienting its assistance and protection work, especially in places of detention, in medical facilities, and in places where people are gathering who have perhaps fled conflict in displacement or refugee camps. So let's look first perhaps at detention. We fear for people who are in prisons. In many places where the ICRC works, clean water is a luxury and soap may very well be non-existent. Physical distancing in some detention facilities is a luxury. It's simply not available to people in these places. And some of that is due to overcrowding as well. We see in a number of detention facilities around the world that they are simply too many people in too small a space. And so being able to deal with something like COVID in those situations is very, very difficult. Some of the places lack ventilation. They have insufficient health facilities, and this contributes to easy transmission of any infectious disease. To give an example, in Iraq, the ICRC has donated protective equipment and materials, disinfectant, gloves, goggles, and gowns to places in detention. And closer to home in Papua New Guinea, where we work quite a lot in the highlands of Papua New Guinea, generally in relation to the tribal fights that are occurring there, we also work in places of detention. And we've worked there to protect both detainees, but also detention staff. And that relates to education, making sure that people know and understand how the virus is transmitted, and making sure that they are undertaking sanitary ways of working. Prisons are also not walled off from the world when it comes to a disease like this. Viruses enter and leave a detention facility because families visit, detention staff and delivery personnel, as well as detainees who enter and leave when newly sentenced or going to court may transmit the virus. Detainee health must be protected, not only because it's the right thing to do, but because it's good for the wider community as well. Prison authorities everywhere are urged to implement infection prevention and control measures. We know from experience that improving access to clean water, hygiene materials, and other measures such as setting up of hand washing facilities can prevent the spread of the disease inside and outside the facilities. Places of detention need to adapt their daily routines to mitigate the risk of contamination while preventing excessive and unnecessary disruption of daily life of detainees. The ICRC has seen such measures prevent things like the spread of Ebola and also cholera in prisons. So we know that it works. The ICRC works together with relevant authorities to strengthen standard practices such as medical screening of new arrivals and setting up these hand washing stations for visitors, staff, and delivery personnel. We support disinfection measures, fumigation campaigns, and distribute soap and other hygiene and cleansing materials. We also help to provide sanitation and other infrastructure to prisons, particularly trying to ensure that waste is removed easily from prisons. But the problems and shortcomings in detention that worries us because of COVID-19 were there beforehand. We see weaknesses that may unfortunately increase health risks for detainees and staff as COVID enters places of detention. One other thing in relation to detainees that people may not think about, of course, is family contact. Family contact is vital both emotionally and psychologically to support detainees. COVID-related restrictions have made these family visits more difficult, adding stress for families and detainees alike during this time. We're encouraging and where necessary supporting detaining authorities to put in place alternative ways for detainees and families to communicate, including by phone or video calls. Such contacts are important both for peace of mind of the detainees but also for their families. We are also encouraging authorities to ensure regular and transparent communication between detainees and families, perhaps through the ICRC and Red Cross messages to make sure people know and understand where their relatives are detained. One other measure that's important is the possible reduction of people in prisons. This can definitely help with the COVID risk. Based on our work in addressing situations of overcrowding and advocating for non-custodial measures and alternatives in detention, the ICRC has brought various options to the attentions of states, judiciaries, prosecutors, and detaining authorities, helping them to think through and balance the many complicated factors that are involved in such decisions. But we've seen that that has worked in a number of countries close by. Myanmar is one of them. IHL safeguards detainees' health and hygiene, IHL being the basis of law in armed conflict. So the protections are there under international humanitarian law to ensure that detainees have proper health and hygiene. In terms of weakened health systems, the safety and protection of healthcare workers and healthcare infrastructure we see as paramount during the epidemic. Healthcare workers can be a target of violence and abuse as they are on the front line of COVID response and working with often distressed families and communities. Ensuring that healthcare workers are safe and able to carry out their jobs is crucial for their protection and indeed to ensure the continuing care of people affected by the disease. That's why we were all quite shocked the other day by the attacks that happened in Kabul, where at a maternity hospital, both babies and mothers and nurses were attacked. We always say that, of course, medical personnel are just not a target, even in times of conflict. The ICRC addresses health concerns in conflict zones in a multidisciplinary way. Both water and sanitation teams working to increase access to clean water, as well as including soap in the assistance packages we give to families who are fleeing violence. Our support to hospitals in conflict zones includes donating supplies and equipment, but also financial support and staff training. We support infrastructure works to expand hospital capacity, to ensure a stable water supply and proper waste management, and to improve the overall medical service delivery. We provide advice and guidance as well as standards to authorities to prevent and control the outbreak. In all health structures and health centres already supported, as well as in the health detention places that are visited, we systematically and thoroughly reinforce infection prevention and control. We also work on dead body management, and I'll talk about forensics in a little while, as well as maintaining food and non-food items, making sure that people have a diet which helps their immune systems. So just to give some of the examples of the healthcare crises that we see, in Syria, for example, which is our largest operation worldwide, half of all health facilities in Syria are out of service or only partially functioning across the country. Large-scale displacement has led to a degradation in access to healthcare and essential services across the country. Areas of active hostilities are hit hard. In and around Idlib, for example, dozens of health facilities no longer provide health services to the population, and this has been since April 2019. This has led to a serious reduction of health services, which forces people who are wounded and sick to be more vulnerable because they're travelling further. There are an estimated 100,000 people living in camps in northeastern Syria, as well as tens of thousands of detainees in already crowded and unhealthy conditions. In Yemen, we've seen an estimated nearly 20 million people have a lack of access to basic health care. In Somalia, which has suffered decades of conflict and now has less than 50% of its people in urban areas having access to medical care. In rural areas, this has dropped to only 15%. So cyclical outbreaks of acute watery diarrhea and cholera, as well as measles, continues to highlight the country's ill-prepared to tackle health emergencies. The ICRC is also readying for a spike in sexual and gender-based violence. In war zones amid COVID, this is something that we see increases. Breaking the deadly cycle of domestic, societal, and political violence is crucial. Service provision and access for survivors is a priority. Along with this is the support that the ICRC gives to mental health and psychosocial support. What we see is that COVID affects a number of populations and their mental well-being. We even see here in Australia, where people are restricted in their movement, that anxiety tends to be heightened. So you look at this in a situation of conflict and you see just how much people's anxiety and lack of knowing what may be the future is heightened. So we do a lot of work in mental health and psychosocial support. And we have someone in the highlands of Papua New Guinea who's actually dedicated to that type of work. I mentioned before about dead body management, and forensics is really important for the ICRC. We see that it's possible that the number of deaths in some countries could overwhelm local capacities to deal with dead bodies properly. The idea of digging mass graves, while it's something which could be used to ensure that the health concerns are addressed, may also mean that people don't know the fate of their loved ones. And so making sure that there is identification of people who have passed is very important. The ICRC has also looked at specific measures, because a lot of the work that the ICRC is doing is in Islamic countries, and the Islamic law relating to the treatment of the dead is quite specific, and so the ICRC has very much worked on making sure that people are aware of those specificities. And in Ecuador, for example, we've delivered body bags, biosafety suits, and N95 masks for the use of forensic services, as well as the armed forces and police and other public entities when picking up, transporting, and disposing of human remains. People who've been displaced, also a very important cohort for the ICRC, because those who have been displaced by conflict are often particularly vulnerable to health complications. They're either in temporary accommodation or they're in camps that can be crowded, often with inadequate sanitation and shelter or little access to medical care or good nutrition. Particular attention should be paid to migrants, including refugees living in either overcrowded or unhealthy environments, the homeless, people in slums, in camps, both formal and informal settlements, with the development of comprehensive contingency plans that follow public health guidance is really important. It's important also not to confuse the restrictions on public health grounds with restrictive measures linked to migration. We've urged states to include migrants, irrespective of their legal status, in their public health, social, and humanitarian responses for the benefit of the entire community, and to adapt it to the specific circumstances of the most vulnerable migrants, irregular migrants, people in camp settings, etc. We've asked to ensure that even in these exceptional circumstances, the humane treatment of migrants and the respect for their rights under international law, including the right to seek asylum, the prohibition of the principle of non-refoulement, and the prohibition of arbitrary use of force, are all respected. We favour cooperation, solidarity, and responsibility sharing in the management of migratory movements in the face of the COVID-19 pandemic. To give just a few statistics, in the Sahel region of Africa, Mali, Niger, and Burkina Faso, you've got about 1.1 million people displaced as a result of conflict. And in South Sudan, which is our largest operation in Africa, 1.7 million people are displaced within the country, and a further 2.2 million are outside its borders, mainly in Uganda. So what can be done in places of detention and in displacement camps? Like everywhere else, the first level prescription is seemingly simple. The most effective step is to wash hands, to make sure you've got clean hands, to have water and to have soap. But for people that we serve, even that can be a major challenge because of the lack of clean water and the lack of hygiene materials. We've been carrying out massive clean water projects for years because we know that investing in this basic hygiene must take place at all times, ideally before the crises hit. But there are still too many people without that access right now. We're factoring the COVID-19 pandemic into all of our programming. We'll step up our prevention and control support in health structures and in places of detention we work in. We'll support authorities, and in particular Red Cross and Red Crescent national societies who are working locally in all of the countries in which we work to reinforce their activities to combat the virus. We'll also continue our work to protect and assist people in situations of armed conflict and violence, because we also need to remember that during this time of COVID, warfare has not stopped, and our work in protecting and assisting victims of conflict is as essential as ever. Thank you.
Thanks very much, Leonard. That's been a very thorough presentation, and it's given us a very clear picture of the ICRC's traditional mandate and how the challenges are intensified under coronavirus, COVID-19. We've got some questions coming through, and do keep them coming. I'll get to some of them in a minute, but I might just get the ball rolling by asking a question about, under the present circumstances, is ICRC seeing new coalitions forming amongst all the players that deal with the people in fragile and conflict situations? Of course, the ICRC is well established. Others have been too, in the NGO community, Amnesty International being prominent. But indeed, the cooperation and collaboration with institutions such as WHO and other bodies in the United Nations, with the World Bank on an economic resilience front, for instance. Can I ask if you're seeing a new coalition forming amongst those actors to deal with these intensified pressures?
That's a really interesting question. What we are seeing is that there is a solidarity and there is a cooperation amongst all of the actors who are working in this space. We are working very closely with the World Health Organization, with WFP in particular, who are providing still a lot of the assistance in some of these areas. But of course, on the other side, we've also seen that some of the restriction measures, particularly those relating to travel, have meant that it is sometimes harder to be able to get in assistance in some of these difficult countries. We've also seen it somewhat more difficult for our staff to be able to travel. So we, of course, rotate staff in and out of some of our big operations, and some of these restrictions has meant that we've had people lengthening their contracts in particular places because either they're not able to leave or their replacements are not able to come. So that is one thing that we have been facing in this regard, and I know that that's the same for some other people, some other organisations around the world.
Okay, we might turn to some of the questions.
Sure.
I see one there from Melissa Conley-Taylor. If I was going to characterise the international response to COVID-19, I'd describe it as primarily nationalistic. The focus has been on each country controlling spread in its territory and protecting its own. Makes me wonder how much appetite various countries will have to assist populations, like forced migrants, that they don't perceive as their problem. Is the message that it is a global problem getting through?
That's a very good question. And I think, yes, we have seen that each individual country that is faced by COVID is having to deal with its own, the people within its own borders. And that's only natural because part of the response to COVID has meant the closing of borders and the lack of people being able to travel in and out of various countries. But what the ICRC is appealing to states about is exactly what I started with, and that's the idea that this is a global problem and it does require a global solution. It does require solidarity from many, many states to be able to respond to this at a global level. One of the things that we would like to see is a broadening of the circle of empathy in relation to COVID.
Okay, then. Just a question here from Dr. Peter McCauley from the AIIA. Does ICRC Australia receive financial support from the Australian Aid Program for its work? What have been the levels of this support from the Australian Aid Program recently?
Yeah, thank you for that. So the ICRC mission in Australia is directly part of the ICRC globally. So funds that come to the ICRC go to the ICRC globally and not directly to ICRC in Australia. We are not set up like some organisations are with particular branches that are funded separately. But what I can say is that Australia is a large donor to the ICRC generally, both in relation to what we call core funding, which is untied funding, and also to some of our projects across the world. For the ICRC, this idea of untied funding is really important because it enables the ICRC flexibility. And when you have something like COVID coming along, which was unexpected, we are able to utilise some of that core funding, this untied funding, to be able to respond without having to ask for specific funds in that regard. Though there is a movement appeal, which is the ICRC as well as the International Federation of Red Cross and Red Crescent, to respond to this globally.
Okay. I've got a question here from Stephanie, who's a little bit more granular perhaps. Many international NGOs and humanitarian organisations have removed their staff from field-based roles to reduce exposure to the virus and further burdening local health care systems. Has the ICRC done something along those lines? If so, what are the protection implications as the ICRC's presence in some locations act as a deterrent for violence? The fact that the ICRC may be impelled to move out of locations.
Yeah, that's something that we've definitely addressed because our presence is generally on the ground and close to the people that we're there to assist and protect. We do have large presences in a lot of the countries where the violence and conflict is existing. I think I mentioned before about rotation and the fact that we do have some limitations on people moving in and out of countries, and we have actually reduced our travel to that which is essential travel. But of course, where we're able to respond and are responding to conflict situations, we've already got people there. So we're able to continue with our responses, particularly in relation to detention facilities and also in relation to civilian populations affected by conflict.
All right. There's a question here from Rose Hawkins, who's asked, can you give some examples of particular issues that people with disabilities and older persons over 60 years are facing as a result of COVID-19? What are the challenges in supporting members of those groups, especially in contexts where they are already marginalised?
Thank you. It's quite interesting because the ICRC has specific programs that work for integration of people with disabilities. The ICRC is one of the largest physical rehabilitation organisations in the world, and we deal a lot in conflict situations in relation to people who have lost limbs as a result of conflict in particular. So we do a lot of work in ensuring that people have mobility and ensuring that they are able to be integrated into society. In fact, in some of our physical rehabilitation centres in Afghanistan, for example, over 90% of the people that we employ in our physical rehabilitation centres are people who have lost limbs. So we are able to have that economic effect on populations. But to answer the question more directly, people with disabilities and older people are often the most vulnerable in conflict anyway. It's harder for them to flee. So they are people who are in situations where they may be directly affected by the conduct of hostilities. And I think COVID simply adds that extra layer of complexity, because we may not be able to move as freely as we were able to check on those sorts of people. But it is something that we definitely have as a major focus of our work.
Another questioner, Shabnam Shafiq, has asked, you talked about the ICRC working in Islamic countries. Currently, of course, it's the holy month of Ramadan.
Yes.
Being observed by Muslims across the globe, and the fasting that takes place from dawn to dusk. Is the ICRC engaging in any work to aid the Muslim community at this time? For instance, providing food by which those fasting may break their fast?
Yes. If you have a situation where we are already dealing with a population, then it would be the case that we would be respecting Ramadan, respecting the fact that people are fasting during the day. And when the people are breaking the fast towards the end of the day, that's when we will undertake more of our assistance if we are providing people directly with food. But more and more, the ICRC is seeing that microeconomic projects, the ability to have people have micro businesses in a number of these countries allows them to have more control over how they're able to respond, and so they would be able to then have those responses directly.
Okay. Got a question here on a slightly different tack.
Sure.
By Penny. I think that must be Penny Wensley. There is a lot of discussion about the need for an international study of the origins of and responses to the COVID-19. Clearly this is needed, but raises considerable sensitivities. Most commentators consider that neither the Security Council nor WHO should lead this. could the ICRC contribute in some way?
That's a very interesting question. I think we may not have the specific expertise in relation to the origins of viruses to be able to undertake such a research or investigation. I think if you're looking at the origins of such a virus and how it has spread, I think you would need people that have real expertise in that area. The expertise of the ICRC in the medical field is much more in relation to how we would respond to the effects of conflict on people. But I think that for future pandemics, as there has been in relation to Ebola and cholera and a number of other outbreaks, it is important, I think, to study the patterns of change. So it's certainly a question that needs to be answered in some form.
All right. You've covered a number of particular cases, country situations in your talk, Leonard. There is a question here from an anonymous attendee. Can you please comment specifically on how COVID-19 is or is not impacting ethnic conflicts in Myanmar and critiques of Aung San Suu Kyi's handling of COVID-19 and these conflicts?
Of course, the ICRC is a non-political organisation, so we're unable to really talk about political aspects in relation to this crisis. But what I can say is that we, as the ICRC, are working in a number of parts of Myanmar. We're working in Kachin State, in Rakhine State, which of course is the area that's had the most press, I think, in recent times, and in Shan State. We are supporting and partnering with the Myanmar Red Cross Society, training their staff to be able to deal with reacting to the virus in Kachin and Shan and Rakhine State. We've been training both volunteers and staff from the National Society on the proper use of PPE, protective personal equipment. And in Rakhine State, we've also been supporting the National Society to upgrade their practices in relation to COVID-19. Hand washing stations have been provided to their officers to make sure that people who are going out to help others are as free of the virus as possible. We've also directly provided in Shan State hand washing stations and some triage and screening tents for people in Rakhine State, providing hand washing stations as well as solar panels for about 13 health facilities. As well as some material support to build both screening and isolation centres in IDP camps.
Great. Leonard, a number of questioners have asked about how local people and organisations can get involved with the work that ICRC is doing. Sally O'Donnell's asking, what is the ICR doing to empower local organisations and partners? And how can individuals donate directly to those activities? What can we do to ensure transparency when working with smaller organisations?
Yes, that's very interesting. I think the ICRC is quite unique in the way that we work, in that a majority of our funding actually comes directly from states as parties to the Geneva Conventions. They see that it's important to donate to the work of the ICRC. But the thing is that local national Red Cross and Red Crescent societies around the world are doing a fabulous job with their local partners. Here in Australia, the Australian Red Cross are supporting people. I mean, they've just come out of some fantastic work in relation to the bushfires and helping local communities there, and are now faced with support, particularly psychosocial support for people who are perhaps isolated as a result of COVID-19. But in a number of the countries that we work, we have national societies that we work with directly. The localization agenda that came out of the World Humanitarian Summit in the Red Cross and Red Crescent movement is generally through national Red Cross and Red Crescent societies. And what's quite interesting here in the Pacific is that you've got national societies that have been dealing with cyclones as well. And when you're trying to undertake measures to prevent spread of COVID-19, and you're having to deal with those sorts of natural disasters, it makes things very difficult for national societies.
I might just follow up that point you made about the Pacific, Leonard, because it is a crucial area for Australia. And because of the situation in many of those Pacific states with very rudimentary health systems, one could only assume they're remaining vulnerable. But to date, it seems the worst of the worst hasn't yet occurred. I'm wondering how the ICRC is set up to respond to a perhaps sudden deterioration in the situation in the Pacific, should unfortunately that arrive.
Yes, the ICRC has a presence in Suva in Fiji, and we also have a large operation in Papua New Guinea. So what we would be doing is looking at some of the work that we've done in Papua New Guinea for the people affected by the tribal violence, particularly those that have been displaced by the tribal violence, and using similar methods in the Pacific. But it's actually our sister organisation, the International Federation of Red Cross and Red Crescent Societies, that are leading the response in the Pacific. That's because the Pacific is not in conflict, and the Federation tends to lead the work in non-conflict disasters. But they have a big presence and are working strongly with the national societies all across the Pacific, as is the Australian Red Cross, to help in the response.
All right. Philip Ellison is asking a question here that moves on a little bit from some of the earlier questions. He's interested in the data of changes and changes to the outputs of the ICRC and the other activities. Is there any evidence that the withdrawal of international players, possibly the ICRC, how is there a sort of a quantification of the impact of those changes that the ICRC can put its finger on at this stage?
I think it may be a little too early to say. I know that I have not yet had access to any data in that respect. I know that when the ICRC is undertaking its work, we're always looking to see how changes do impact the ICRC, and we've actually got a directorate in our headquarters dealing with digital transformation, which is also looking at data and research in this sort of way. But as yet, I don't have any of those statistics.
All right. Well, we seem to have covered quite a bit of ground already. And I think many of our questions have been covered. I'm happy to take questions from okay, there is one here. It's a more general question, I think, from Sukrut, asking, after the pandemic, what are the major changes that international organisations in general are going to have to face up to?
Yes. That's a finger in the wind sort of question, because we I think are still at a stage where we don't know exactly how COVID is going to play out. We don't know how that is going to affect many aspects of life in the future. But one of the things I think we will know is that the economic insecurity that is faced by people in fragile situations and the most vulnerable are not going to be improved by a situation like COVID-19. I think the economies of the world are definitely going to have to be rethought in certain ways. One of the things that the Icrc hopes does not happen is that there is any downturn in the relation to funding of organisations such as the Icrc, because if you have large countries with big economies having to deal with downturns, of course, one of the things that is looked at is international aid. But we've been encouraged so far that a number of the countries are maintaining aid to organisations such as the Icrc. And I think the thing is that this humanitarian response is even more vital now. So I think support is also vital.
I just want to ask, at this time, how does the Icrc get its message out? It's obviously a critical time, and the resources that you have at your disposal are fully stretched, no doubt. But what sort of mechanisms are you intensifying the use of to get the message out about adequate resourcing and donations and assistance to displaced and vulnerable people?
Well, I think the thing is that communication is always key for the Icrc in the situations in which we work, because if we don't communicate, we're putting ourselves in peril. We're putting our security and our people at risk if we don't communicate how and what we do. But that's also, of course, the case when we're talking to influential states as well. So what I think is really important is that in the time where almost everything is COVID related, it's hard to cut through with non-COVID stories. And I think one of the things that we're trying to do at the Icrc is to make sure that people understand that the conflicts are still existing. The general work that we are doing is still there. It's just this extra layer that we have to face with COVID.
Right. Well, look, we seem to have stretched all the questions out and covered them in one form or another. So I think we might draw the proceedings to a close for the moment, Leonard. And I just wanted to say thank you so much for being our volunteer test pilot for our inaugural online presentations of the ACT branch of the AIIA. It's been a tour de force as far as the presentation goes. We've dealt a high level. We've also gone into a lot of country situations of interest to a number of the people that I know are looking at us tonight. So on behalf of the membership and all hopefully prospective new members of the branch watching, I'd like to say thank you so much for coming along. And I'll have to just give you an applause
Thank you. Thank you.
On everyone's behalf at that stage. And do invite you to come back to our meetings as often as you can, whether it's online or hopefully in the future face-to-face.
I look forward to that. Thank you.
Great, Glenn.